Okay, good afternoon, everyone. My name is Marlene Demetrio. I'm a PAB at the Julius Richardson, and I will be giving you your oral health care refresher, specifically for the PABs. So our context today is dysphagia patients that are high risk of aspiration pneumonia, and rigorous oral care has been shown to reduce the risk of aspiration pneumonia. The objectives of this program to ensure integration of best practices related to oral hygiene, maximize the safety of feeding and swallowing activities, reduce risk of complications from aspiration, and maximize client independence with activities related to oral hygiene. The steps of this program are oral health screening, oral health assessment, and oral hygiene plan completion that's carried out by the PABs. The oral health screening. RNs to screen all patients on admission within 72 hours of admission for the following elements. Criteria for patients at risk from compromised oral health. Patients at high risk of aspiration, NPO patients, and they observe the white coating on the tongue. And if yes to any of the above, proceed to the oral health assessment that will be given on the from the RNs. And that is the oral health assessment that the RNs do on the admission. So that's a bunch of, they have to check the lips, the tongue, and they have to make their assessment with all that. So they take care of all that for us. And then here's the oral hygiene plan, which is given to the PABs after they've completed the assessments with the RNs and the patients. So they will tick off, they can tick off items on here that we'd have to check when we're doing our oral hygiene with our patients. Could be the white tongue. What else do we have on here? There's, if they need supervision, if they need cueing, they will tick off on here what we need to check. So no need to worry, everything will be there. The implementation of the oral hygiene plan. The PAB implements the oral hygiene plan. A copy of the oral hygiene plan will be given to the PABs with their work assignment. And the PABs must communicate any difficulties, challenges, or changes in the patient status to either the RN or the LPN. So any changes that we see, we must communicate with them. Client family education. All team members contribute to the client family education based on the oral hygiene plan. And here we have all the members that are taking care of the patient's oral hygiene. It could be the dietitian, we have the OT, the pharmacist, and everyone plays a role in making sure that we are giving a good oral hygiene care to our patients. Okay, here are the roles and responsibilities of the different team members. The RN screens all newly admitted patients within 72 hours of admission for high risk of complications from potential aspiration pneumonia. A completed oral health assessment tool for patients at risk for compromised oral health. And they also complete the oral health plan, and insurance plan is included in the PAB work assignments. The LPN's roles and responsibilities, they contribute data to the RN's oral health assessment, and PABs implement care plan as indicated. And once again, we inform the RNs or LPNs of any changes in the patient status and improvements. And here we have roles and responsibilities of the speech language pathologist. Collaborates and supports team on issues related to oral hygiene. Is consulted and provides option related to oral hygiene care to nursing team, in particular for patients with severe dysphagia and or aphasia. Contributes to diet progression evaluation based on oral hygiene status. So you can see everyone is included in the oral care. And here we have the roles and responsibilities of the OT. Therapeutic interventions in view of maximizing patient independence and safety in oral care, and recommend adaptive aids, strategies to foster independence as needed. They recommend proper positioning to foster delivery of oral hygiene tasks, and consulted for functional assessment to clarify patients' level autonomy in the execution of activities of daily living related to oral care. And we have the dietitian. Screen during initial clinicial nutrition assessment and flag to RN if any issue is observed. Reinforce the importance of adapted oral care and encourage client, family, and staff to follow all the oral plan care, and they implement diet progression based on oral hygiene status. And then the roles and responsibilities of the family and the clients. To participate and collaborate in the development of the plan care, as well as follow and share in its application, keeping in mind the safety of the patient. And this, we apply taught strategies when possible. So we want them to be informed as well to keeping good oral hygiene. And so why do we brush your teeth? Well, regular and thorough brushing removes the plaque and that causes gum disease and decay. And rigorous oral care has been shown to reduce the risk of aspiration pneumonia. How to perform oral hygiene. You use a natural toothbrush, not the blue sponge. Dentures are to be removed. They are at nighttime, so we have to clean them in the morning. And not to forget to brush the tongue, because there is a lot of bacteria that builds up on the tongue. How to brush your teeth. You brush at a 45-degree angle. Use a gentle circular massaging motion up and down. Don't scrub. Clean every surface of every tooth, the chewing surface, the cheek, the side, and the tongue side. Thorough brushing should take approximately 2 to 3 minutes, using a soft brush with rounded bristles. And don't forget, again, to brush the tongue. So there's key points of oral care. The toothbrush is the best way to clean. Foam scrubs offer moisture to the mouth. Suction toothbrushes available from the assistant head nurse. And list of oral care items are noted in the welcome booklet given on admission. And that's for family, and clients are encouraged to bring their own toothbrush and toothpaste. And if it's not available, we have them here on the floor. And another key point is the hospital bracelet. It's a reminder that the Richardson client ID bracelet is white. Ensure that the acute care hospital bracelet has been removed. The blue dysphagia bracelet, do not write on it or addressograph the blue dysphagia bracelet. And the IDT goals are to identify oral care as a goal in the rounds booklet. And thank you. I hope you enjoyed this presentation. And if there's any questions, please don't hesitate to ask us at any time. Thank you.